90% of all colon cancers occur after the age of 50. So age is probably the single most important determinant in identifying a particular population in getting screened for this. So anybody above the age of 50 should have their colons screened for polyps and cancers. The next most important thing is those who have a family history, either first degree relatives or second degree relatives, they have an increased incidence of developing cancers. In fact, 1 out of 4 people with colorectal cancers have a family history of either polyps or cancers, and therefore people with a family history should definitely have the screening test done.
Certainly the symptoms you would look for would be change in your bowel pattern or bowel habits, narrowing of your stool, flattening of the stool, or what we call ribbon stool, and certainly the biggest warning would be any bleeding, blood that's coming from the rectum, even something simple like you see a little fleck of blood streaking the stool. Those will be things that should be addressed.
Other factors that influences in increasing the incidence of colon cancer, like patients who have had long-standing inflammatory bowel disease like Crohn's colitis or ulcerative colitis, if they've had it for 8 to 10 years, they have an increased risk of developing colorectal cancers and therefore would definitely need to be monitored on a regular basis to catch those cancers early or even in the pre-cancerous stage so that they could save themselves from developing this cancer. People with long-standing diabetes have been known to have an increased incidence of colorectal cancer. Obesity is one of the risk factors for this. Smoking is a risk factor. So chronic smokers, obese patients, patients with diabetes, all of this have an increased risk of colorectal cancers and definitely would benefit from getting their colons screened.
I try to impress upon people how important colon cancer screening is. Colon cancer is one of the silent killers. You can be walking around with a cancer for 10 years and never know it's there. But it's also one of the cancers that gives us a chance for cure. Colon cancer is easily detectable. It's easily curable if it's found in the early stages, and one of the few cancers that we can say is totally preventable. If we can find polyps before they get a chance to mature and turn into cancers, you can't get a cancer. So with those things being said, colon cancer screening is certainly one of the most important screenings that you can ever have done. Colon cancer is common. There's over 150,000 new cases each year in the United States, and unfortunately there's about 50,000 deaths related to colorectal cancer in the United States. So it is something that we can really make an impact with. Screening is simple.
Screening colonoscopic examination has made a tremendous difference in the outlook of colorectal cancers since 1987. Tools that have been used to extrapolate the data since 1987 has shown that there has been a 53% decrease in the mortality of colorectal cancer directly attributable to colorectal screening. At the present time, about 61 to 62% of the people in America have been adequately screened. So that leaves us almost a 40% deficit, and I truly believe that if we were to get that particular population in to be screened, we are going to see a much significant decrease in the colorectal cancer mortality in this country. Absolutely. It is a very highly preventable cancer with 90% of all cancers that could be prevented if the patient were to have a full colonoscopic screening and all the precancerous and adenomatous polyps were to be removed.
The data clearly shows that if you do the screening at the appropriate intervals and the appropriate time frame, the amount of cancers that are caught are clearly almost always in the curable stage. If you do wait and decide that fear might prevent us from doing this procedure. Unfortunately, these people are the ones who are caught at later stages that really sometimes aren't curable.